So my role is as a clinical informatics lead, and so I moved into this type of role about 10 years ago. Got a background in working in various aspects of nursing across neurosciences first, and then pain specialism, and then I was a clinical educator. As part of my clinical educator role, I took on some extra responsibility for being the clinical lead for an IT project. At that time, it wasn't necessarily what I thought I wanted to do. I'm not particularly technology proficient, or certainly wasn't at that time, but it was an area that really interested me. So over the course of the last 10 years, I've then increased the amount of work that I'm doing so that I'm now full-time working in clinical informatics. I moved to Nuffield Health about 4 years ago from the NHS after about a 20-year career in the NHS. And now work for Nuffield Health as leading the clinical informatics team, as well as leading a change and transformation team, and also an operational team in Nuffield Health. I got into it little by little, but very glad to be here now, and would always intend to carry on working in clinical IT. I haven't completed any specific qualifications for this role, but I would say that many of the different qualifications that I've done as part of my nursing career have really led me to where I am now. I would say that the most important of those is that about 2-3 years ago, I completed a master's degree in healthcare leadership with the NHS Leadership Academy, and I feel that that's really the thing that set me up for moving my career in this direction, particularly into the leadership role that I have at the moment. I've also done various other pieces of courses and development, some of them centred around IT, although I would never want to take on a more technical role. I feel that I work with people who can much more ably do that than me, but I have completed a number of courses around the non-project management elements of projects and programmes. So I've done short courses in things like business change and transformation, and also in managing the benefits of clinical technology. So those are the short courses that I've done as well on top of my leadership masters. So my day-to-day job is as a leadership role. Nuffield Health are in the process of implementing an electronic patient record across their 31 hospitals, and I am one of the programme leads for that role. So a big part of that is in leading a team of people. So I manage a team of clinical and non-clinical experts, and I spend much of my time leading those people. The clinical team is a mix of nurses and other allied health professionals, including radiographers and pharmacists, amongst others. And I also link in on a day-to-day basis with our doctors, the consultants who work in our hospitals. So predominantly my role is in leadership, but I also have the accountability for the clinical safety of any IT systems that are implemented within my organisation. So Nuffield is looking to connect up the care that it provides across the business, and my role is in linking all of that together from a clinical perspective, but also making sure that every IT system we implement is clinically safe. I think professionally and personally, it's probably the same things. I'm really passionate about the use of technology, particularly by nurses, but by allied health professionals and medics as well. I feel that we can really make some massive patient safety improvements and improve the way that we deliver care to our patients through the use of technology. And I'm really passionate about that. I'm pretty enthusiastic as well. Sometimes I need to be quite tenacious in my role to make sure that people are listening to me. And sometimes I can be the sole voice sort of advocating for the use of technology. And I feel that that's what I bring to that role. So yeah, passionate, motivated, enthusiastic and tenacious where needed. I guess it's perhaps a little bit of a cliche to say it, but everything. I love my job. I never thought when I started out my nursing career 20-something years ago that I'd be working as this bridge between clinical practice and IT, but I absolutely love it. I love the day-to-day being the bridge between my colleagues in the IT team and my colleagues in the clinical team, and I really feel that I can offer something in terms of bringing the clinical perspective to every conversation about the use of technology. So I guess, as I say, it's a bit of a cliche, but I love everything about my job.